The culture of care for people living with dementia is evolving. A person-centred approach is believed to be key to health and well-being for those living with dementia and their carers. Sandy Kay visited the University of Sydney's Cognitive Decline Partnership Centre in Australia to see how research from the centre is providing evidence for improving care practices.
By age 85, 1 in 3 of us will develop dementia. As the most common cause of death of elderly women in Australia, it's crucial that we start to look at the best ways of caring for those living with dementia and, quite simply, to get better at doing it. The Cognitive Decline Partnership Centre, or CDPC, is an Australian dementia research centre at the University of Sydney, which examines best practice care to enable people living with dementia to enjoy the best quality of life possible.
The reason the Partnership Centre exists is to improve care for people with dementia because we haven't been doing it as well as we could.
Professor Susan Curl is the director of the government and partner-funded CDPC. She oversees the ongoing research through 33 funded projects.
The Cognitive Decline Partnership Centre is exactly that. It's a partnership, a collaboration between researchers, clinicians, aged care providers and consumers working together to look at improving the quality of care for people with dementia and their families.
The CDPC's research has enabled development of evidence-based resources, including Australia's first national clinical practice guidelines for care of people with dementia. Consumer advocate Elaine Todd says the Consumer Companion Guide was developed as a user-friendly guide to the clinical guidelines, a useful tool for people living with dementia and their carers.
The consumer's voice is the lived experience, and the lived experience for academics is the one that they have to listen to.
One of the centre's major projects looked at what the best residential care environment would be for people with dementia.
What we found was that the cottage model of care, so that's small home-style living, is really beneficial to people with dementia. Their quality of life is better, the quality of care is better, they have less hospital visits, less GP visits and less medication.
This is being applied in Hammond Care, an optimal home-style environment. Each cottage is built for 8 to 12 residents and reflects the way a person has lived all their life. Routine daily activities and physical exercise are strongly encouraged.
What we are highlighting is the real importance of keeping people moving, keeping people strong, keeping people engaged. If you are able to move around, you're able to get out. You're enjoying life more. You're going to have a better quality of life.
A handbook on reablement interventions provides some timely recommendations on how to maximise wellness.
There are interventions that can either help slow down that rate of decline or even result in some improvement in the person's physical abilities, functional abilities or communication. And so I think it's important that when we're looking at somebody with dementia, we don't lose sight of the fact that there are some positive things that people can do.
Researcher Dr. Craig Sinclair has been looking at the importance of supported decision-making. He says in Australia today, it's very much about consumer-directed care.
The reason that we've put together this project is really to try to understand what do people with dementia and the people who are caring for them feel about this process of supported decision-making. What do they do in their own lives? How does it work for them? And what could be improved?
The CDPC's research program is having a real impact on the care of people with dementia.
We're hoping that this information will travel far and wide. It will reach carers, it will reach people living with dementia, health professionals and service providers.
We want everybody to approach dementia with the same level of scientific rigour, because there is really good evidence for a number of interventions with dementia and a lot of people aren't aware of them.